Hey, everybody, welcome to the Uncaped Mama podcast, where I help you shed the superwoman persona and just be. As a mama, as a woman, as a friend, as a supporter of mamas, this is just your place to exist. So, thank you for joining me. I am Dom Gonzalez, and I am your host. Let's dive in. Okay, so welcome to the Uncaped Mama podcast. Thank you for
Hey
joining
girl,
me.
hey.
Hey, girl. I have a dear friend of mine who I really did not know that we were going to get as close as we've become in the ways in which we've become close, meaning her literally being there for the birth of my first child. I didn't understand that journey and what it would take me through. And I'm really grateful that you decided to become a doula, become a counselor, become passionate about education and all that sort of stuff. And so when I knew that I wanted a guest, I knew that you had to be the first one. So I
Yay.
literally pushed everybody else off. Like I got other folks on the roster and I pushed everybody off until you.
Listen, I feel so special.
And
Don't get
you
me to
did.
crying.
Oh Lord, we cannot start with you crying.
Okay, I'm sorry.
So you all, this is my lovely friend Arija Israel. I went to college with her um, at St. Louis University. We have been friends for a long time, 21 years
Listen,
probably.
don't say the number out loud, just
I
a long
know,
time.
a
It's
whole
just been a long
lifetime.
time.
Our friendship is legally able to drink now. So those are
Oh
these
Lord, where's
for
my
our
water?
relationship. But you introduced yourself. Tell us all of the things that you do. I'm like, I could start listing it. And then I was like, I don't know which one's most important because I was going to be like, she is the husband or the wife to husband, blah, 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 blah. And then I'm like, you know what? Let me not. Let me just let her tell us. So tell us everything you do. Tell us your socials, your website, all of that too, because you are like me. We forget to make things public when we share it. And so I
Every
want
time.
to start with you. I want to start with you telling us all of that.
Yeah, so I am Dula Araja Pua. My so starting off, my social is Puas underscore heart. On Instagram, also have a Facebook page and website is puasheart.com. I am the wife to a amazing music producer, Gumbo, who is also on Instagram. uh, Gumbo music underscore, just FYI.
I was gonna
And
say you better tell
mother.
that too, because they need to
Listen,
go on over
listen,
there
they
too.
need to know, okay? She is the music producer of all music producers. And I'm also a mother to six children. I don't know how we got there, but we did. I'm making it, I'm surviving the motherhood life. But I'm also a birth doula, a certified breastfeeding specialist. I am currently in grad school for counseling. It's a whole lot, child. Yes, it is. So yeah, there's so many things to name, but I think that's the gist of it. Yes.
That is the gist of it. And if more comes out, I mean, they're gonna listen, so they'll pick up on it. So why doula? Why counseling? Why breastfeeding support?
Yeah. So when I was pregnant with my oldest, so Kai, she is now 17. Don't you start crying. Um,
I'm sorry.
yep. Take a pause. Take a break. Yep. I said it. She's 17 now. Yes.
Wow.
Yeah. I know. Crazy. When I was pregnant with her, I knew like I wanted to have a baby. I knew like it was, like a time to be celebrated, a special time, but that's about all I knew. I used to sit up and watch Baby Story all the time. I only wanted to watch the Black families. And then I only wanted to watch the ones where they were at like birth centers and showing like those stories. The hospital ones, I don't know. Back then, the hospital ones, they always just showed the women like screaming in pain and all. And I was like, I don't want to see that. So for me, like I was like, oh, I want to have a water birth too. But at the time, I was on Medicaid, and I was like, that's not a possibility for me. Medicaid is not going to cover a water birth. So I ended up just having her, in the hospital. It was slightly traumatic. the way that it had, like, I literally did not prepare for this at all. I don't remember taking it was, listen, so long ago. I don't remember taking a childbirth education class, like none of it. It was literally just watching Baby Story all day, every day, as much as I could. And so when it came time to give birth, it was just so much. It was way more than I expected it to be. And I was like, yeah, I don't ever want to do this no more. Not another day in my life. And then I got married and we had a second child. And so that situation was even like more traumatic than the first one. And I was like, what is going on here? Like, I'm not enjoying this. And literally, again, I remembered from the first one wanting a water birth and like feeling like that still wasn't going to be an option because I was still on, state assistance. So years passed by. I'm like, oh, I want another baby. I Yeah, I don't know where that came from, but I wanted another baby, and ended up conceiving again and remembering like, oh my gosh, like this could be the time I have an actual like water birth at a birth center with a midwife. And when I initially said it to my husband, he was like, heck no, like you do not take pain like whatsoever. You can't take a paper cut. You are crazy. And I had actually really been doing research about the benefits of water birth, about the benefits of like not birthing in the hospital, just kind of, like on your mental and physical. And once he saw that I was serious, he was like, yeah, let's go meet a midwife and let's see. And so we went and met a midwife, and it was like the greatest experience ever. As soon as we left, I was like, so are we going to do this? And he was like, heck yeah, we doing this. And he started telling everybody. Um, and most of the people that I told were like, yeah, no, like that's what white women do. Like we don't do water birth. We don't. And I was like, wait, what are you talking about?
Really?
Like, yes, it
I
was,
don't
it was,
even
it was,
I don't
listen,
even think I had heard of white women doing water births. Like that's
yeah,
not I the first time I had ever been exposed to natural birth, water birth, epidural free birth, that sort of thing. It was Black and Hispanic women. It,
yeah,
I,
like
that's
literally.
interesting.
It was two ends of the spectrum. It was those people who were like, "You're crazy. This is not what we do. You're gonna be wanting pain medicine. You should just do it in the hospital." And then there was, a handful of the, like, "This is great. Can't wait to hear your birth story." I would, love to even. Some people were like, "I would love to even be there," and I was like, "Now, hold up, slow down. Like, I don't know about all that." So once and this was a very successful like birth. It was almost picture perfect in how it happened. And once I began telling people the story, I began to get, well, can you be my doula at my for my pregnancy and my birth? And I was like, first of all, I'm not a doula. Like I just did this. I'm not a doula though. And then I didn't even really understand what a doula was. And so the more people kept saying this, I was like, well, let me figure out what this is. Um, and kind of do some research on it, get some education on it. And once I realized what a doula was, I was like, oh, time out. Like I needed this for myself because when I went to look for the midwife, I knew I wanted a Black midwife. I could not find one, and I had to get a referral from somebody to even like know that there was a Black midwife in DFW for me to even go see. It was very hard for me to just go online and search for these people. And so I knew then like I needed to become a doula not only to support pregnant women, but also to be able to give them the resources of the people who look like us that they could go and get care from. And so that's kind of where the, becoming a doula came from. And just so much misinformation about birth, especially epidural free births, vaginal births, births after C-sections and, repeat C-sections, that type of thing. It was a lot that I did not know and that I had to find out. And I knew if I didn't know that there had to be so many other people who didn't know as well. And so becoming, a doula just seemed like the thing that I needed to do to be able to help other, women who potentially were also in the situation that I was in. And then as far as counseling, that's a whole nother topic for another day. That's a long story as well.
Okay.
But I do want to, with counseling, focus on perinatal mental health and help women who are struggling during pregnancy, postpartum. The research that I've been doing lately shows that at least 1 in 5 women suffer from a perinatal mood or anxiety disorder. And then, so that's women in general. So then, for us, the numbers are going to be even more, dismal. And then we're the ones who are not going to be getting the treatment, the diagnosis, the proper care for those things. And so that has become like a new passion of mine to, kind of help in that area as well. And then with breastfeeding, um, I knew I wanted to breastfeed from the moment I knew, found out that I was pregnant with the first one. And that's just something that literally, when I knew I knew I wanted to do it, but when it came time to do it, I had no idea what the heck I was doing, and it was rough. And I don't know if you remember Tisha, but she came over one day and she was like, "Girl, what the heck are you doing?" She was like, "This is how you're supposed to be doing this," and she literally showed me how to breastfeed Kai. And from there, I was like, wow, like this is crazy. Like we had a great breastfeeding relationship. Every single child, had a great breastfeeding relationship. And so I decided to just take the certification to be able to share and teach again, share and teach, the things that may not be known when it comes to breastfeeding, the myths, the things that people just do not understand about breastfeeding. And so that is definitely a huge passion of mine as well.
I love it. I was like, we could get into all of the myths and things, and
Listen,
it would
that's a whole
be
nother
that's a
podcast.
podcast period, multiple
Yes.
seasons in itself. And who knows, maybe we'll get to that one day. But I wanted to talk through and just have a conversation about um, the like my journey in interacting with you and then choosing you to be my doula. And so some of this you may not even know. Um, but it's okay. Don't cry. Cry after
Talk
this
to
one.
me. Tell me. I'll cry
So
later.
so when you decided to become a doula, I was fascinated by the information that you would share on Facebook. I knew that I wanted to be a mom. I've always known. I didn't know when, and I got into a place right before probably I conceived Nova where I said I'll just be an auntie and like godmom.
Hmm.
I'll be fine. I had put so much pressure on myself to birth soon or like have a relationship, that worked out where I could, do this the right way and all these sorts of things that I'm like, maybe my body can't do it because I've got health conditions and stuff that technically actually have nothing to do with like my body's ability to birth, but I had convinced myself that maybe I can't. So I literally prayed and was like, okay, God, like if you don't want me to have babies, cool. I do have responsibilities to other kids. I'm good. And guess what? This whole time I've learned all these amazing things that like I can share with other moms or people who want to be moms. Great, because Araja is like sharing this stuff and I'm learning, and I would share with other people and people would message me and be like, wow. And I'm like, listen, I don't got no kids. I can't tell you nothing about it, but you should connect with her because she knows all about all of this. But I was able to be exposed to natural birth. That birthing vaginally is doesn't have to be like terrifying. That if you end up with a C-section, you want to at least be educated about the process instead of just blindly choosing it or just accepting it. I mean, I learned so much that I said, this is awesome. And then I found out I was pregnant. I was very sick. But I knew like confidently, I need a doula and a midwife. It was like one of the first things that I figured out how to do. Now at the time I was unemployed and I was my company
You're
had
like, yes,
closed
need to do,
after
but how?
COVID. Yeah. So I'm like, how am I
Yes.
gonna do this? No job. I had been unemployed for almost a year at that point. I picked up like a marketplace insurance plan and come to find out it actually funded, for the most part, paid for um, a midwife and childbirth education. And you were talking about the childbirth education class. I knew it was coming
Hmm.
in the summer. I immediately signed up. I took that thing 3 times. That's a whole there. Signed up for that. I happened to be in another Facebook group with Crystal, who I got to get on
Mm-hmm.
today, who ended up being my midwife. And you had known, like you'd heard of her. So I was like, oh, this is where I need to go. And you kept talking about taking your babies to the chiropractor and like
Mm-hmm.
how it was helping with these milestones and how it was helping you. And I had been to the chiropractor before and it like wasn't necessarily a great experience. Like you, they kind of get you in and out like on a
Right.
regular like chiropractic doctor. And so I'm like, how exactly does this help me as a pregnant woman? Then found out about
Mm-hmm.
Dr. Mama Bird, Dr. Alex, um, and went to her and realized it's a completely different
Completely. So
experience.
totally different.
Yes, so I've got
So different.
this team of Black women to support my first birth. Um, and I needed that because the relationship I was in was over by the time I found out I
Mm-hmm.
was pregnant. And
Mm-hmm.
one day I'm going to talk about that and
Yeah.
all the
Listen,
things.
also traumatic and toxic and weighing heavily on you during pregnancy.
It's tough, which is why I'm
Yes.
happy to hear about your counseling journey because a lot of like that matters too, mamas who are listening. So I know I connected with you. Like we were good to go. You told me about
Mm-hmm.
birth plans and how everything would work. I started doing visits actually with an OB first.
Mm-hmm.
And
I remember that.
I was sick. I had hyperemesis gravidarum. And this lady seemingly did not care.
Right.
Like I would call after hours and say, like, I can't keep anything down, including water. I am weak. Like, I'm super concerned. You know, Brittany, my best friend, is like, we're living together at that time. She could look at my face and be like, you're about to get sick, aren't you? And I couldn't shake my head fast enough before it was like, yeah.
Yeah.
She would be on the phone and she'd hang up from whoever. She'd be on like a podcast or whatever. She would move it all away to like come support me because she knew it. Like, she knew it was
Yeah.
happening. And I would call the doctor, and this lady's like, I mean, just drink some water. I
Right. Look, like
drink some water, like,
I've been drinking water.
and then it comes right back up. Like, what are you
Right.
saying? Sorry, y'all. Trigger warning. Pregnant people stuff. um,
Like I've been drinking water, ma'am. Like
you're
that's why I'm
drinking water.
calling you.
Yes, I'm trying to eat a balanced diet, like struggling, and it got to the point where I called one night based on I had just gone in. I had like an overnight or 2 night stay because I couldn't keep things down. I was severely dehydrated, had all this stuff going on. And they give you this paperwork that says if any of these things happen, you need to call. So I called the after hours number. My OB at the time happened to be on call. And she was just very blah. I'm
Yeah.
like, you said blah, 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 blah.
Right.
All of that is happening and potentially more. Like, I can't keep up. And she was just like, man, I fired her that day. I was done. I called the next morning. I'm like, you can cancel all of my appointments. Of course, they keep trying to
Mm-hmm.
get you to come back. Brittany,
Right.
progressing in your pregnancy. No, I'm good. I found somebody else. I'm like, I found a midwife. And then she tried to talk me out of it. You don't want a midwife and a doula because all of these things and you're super high risk. And I also fired by the way, the high risk specialist as well. Because on my first appointment, before this lady ever examined me, she told me, we're probably going to induce you at about 38 weeks.
Like
Huh?
what?
First of all, how do you know I'm
You
really
like
going to be
me?
pregnant at that point? But also, huh? How do you know that my child is going to be ready to come then? And y'all, by the way, this child tried to climb into my skin this morning. So if he could still be in my body,
You
at
still be pregnant.
if he could still be in my body at almost 3 years old, that would be his
Listen.
happy place. So it really threw me off because I'm like, how are you telling people that? And it opened my mind to say it doesn't have to be this way based on everything that you were sharing.
Mm-hmm.
So pausing really quick on my story, how often do things like that happen in the women that you're working with?
All the time. It happened to me. Listen, when I was pregnant with Zimri, so number 5, um, I knew I wanted to do unassisted birth, but hubby was not on board yet. And so I was going to meet with midwives. Unfortunately, they were white because is who my insurance covered at the time, and there was no connection. I was like, I can't. Like, I don't want them in my birth space. They weren't listening, first of all, to what I was saying, like what I wanted. And then there was just no connection. And so I ended up finding an OB that was just down the street from the house. I was like, well, I'll just go here. I'll, meet her, get an appointment done, make sure. Because at this point, I was like 5 months and I had not been seen yet. I
I
was like,
remember that.
just,
I remember you
yes.
telling me that. That's right.
Yep. So I just went down the street, found this Black woman online. Unfortunately, Black woman online. And my first appointment was the sonogram. So I didn't even see her. It was a sonogram. They did not let me have my cell phone to FaceTime my husband. They were like, you cannot. I'm like, but this is my appointment. Like, I should be able to FaceTime my husband, like, of all people.
In this
And they
room,
were
it's
like,
a
yeah, in this
private
room,
room.
yes. And so they didn't let me do that. And then they were like, well, you'll come back in 2 weeks to see the OB. So I came back in 2 weeks. And I remember walking in I don't remember if it was at the sonogram, but I remember walking in, and in the lobby, there was a sign on the wall that said no children were allowed. And I'm like, well, that's red flag 1 or 2, because how are you in here supporting people growing families and they can't bring their family? um, so that was a whole issue. And then I went to the back. The nurses ran my, vitals and all that, did the test. And they said, well, you can go in and get undressed because she's going to want to do a pap smear. And I said, no, thank you. I don't want a pap smear. And they were like, well, she's going to want to do it. And I'm like, and I said, I don't want it. Like, I don't care what she's going to want to do. I don't want one. And they just kind of were like, okay. So walked in the room, waited on her to come in. And the very first thing she said to me was, I heard you don't want a pap smear. Well, hello, nice to meet you too. Like, yeah, no, that's exactly what I said. And she never even asked me had I had a pap smear. Mind you, this is baby number 5, and I had already had 2 back to back before that. So she didn't even ask me, like, had I had a pap smear in the last couple of years, where they could just request my paperwork. So I'm like, you're not doing a pap smear today, ma'am. It's out the question. So then she proceeds to tell me, because I was over 35, how those pregnancies go, and how I was gonna have to go see a fetal specialist and get these extra tests. And I was like, ma'am, you have not even like examined me. You haven't like talked to me, like nothing. It was straight out the gate. This is how this is gonna go. This is how this pregnancy is gonna go, as if she knew me, my body, yada yada yada, as if we've been down this road before with all the other, like, I'm just meeting you for the first time. She listened to the heartbeat, she measured my stomach, and then she proceeded to tell me how to wear my seatbelt, as if I didn't have 4 other children and been pregnant 4 other times. And I'm not a grown woman, of how to wear my seatbelt while pregnant. And that was the whole appointment in 15 minutes. And I said, I will never come back here again. This will not be a provider for my pregnancy. And literally after that, I went on to have an unassisted birth because I just couldn't.
It's wild that healthcare professionals operate in that way, right? And I
Yes.
understand that they have a number of patients, but you haven't introduced yourself. You haven't asked
Mm-mm.
any questions about my
Any
delivery.
questions?
This is all about something else. Essentially, the way I'm looking at it, something else you can bill
Yeah.
outside of our regular appointment, because you're gonna bill for the sonogram, you bill for the pap smear, and then you're gonna bill
Listen,
for
everything.
everything else that you do. And that's what you cared about, is how do you make
Yeah.
money? And listen, I get it, stuff is expensive, but this is also my body. I
Right.
am growing this
Yeah.
child in my body, and I'm a parent already.
Yes. And they told me that this was my appointment to establish care. No care was established. Your ignorance was established. That's what was established. And the fact that I will never step foot here or refer anybody else to you. And I later on, some of the other doulas that I work with, we had a client who also had her, and basically was forced to be induced and have a very traumatic birth of her own from this same Black OB that we thought initially was going to be for us and was not.
Wow.
Yeah.
So if you're listening and you don't understand why this is concerning, you'll have to look at the rates of like just related to childbirth, to care. There is already systemic racism in a lot of places, but absolutely in the healthcare system. We're not even adding on income. Like then you add people's income to that, and if they can even afford care,
Listen,
it gets even worse. And there's a lot that happens to a woman's body while she's pregnant. And
right.
what you want to
Mentally,
happen,
physically,
yeah,
emotional, like everything. Yes.
hormonally, everything. There's a lot happening constantly. You need the absolute best care. When I was pregnant with my first, so I have a condition called acute intermittent porphyria. It's a genetic condition. While both sides of my family are like, we don't have that.
Right.
Somebody got it.
I remember
I
that
got it.
too.
It's genetic. Um,
Yeah.
so
Like somebody has it.
so my hematologist wanted to meet with me first before I really saw anyone else because childbirth or pregnancy can sometimes trigger a porphyria episode. It actually did, and I didn't know that I was pregnant at the time. So 2.5 weeks or so before I found out I was pregnant, I was in the hospital for 11 days because I'd had a porphyria flare. And we could not figure out what it was from. Like I wasn't even being unemployed and kind of hustling to make money the best way I could. It wasn't overly stressed when we did a stress test. It wasn't like I hadn't eaten the wrong thing. I hadn't been drinking excessively. Like sleep was good. I hadn't been fasting. All these things that are normal triggers. None of that was happening. We could not figure it
Yeah.
out. So he wanted to see me again shortly after. That attack to do a follow-up. So I go, now I know I'm pregnant. And I tell him, by the way, I just found out I'm pregnant. And he freezes and he's like, that's why you that's why
Yeah.
you had the porphyria attack. And I'm like, what? And so he talks to me about, in my condition, the porphyria attack, like sort of what it does to all the hormones and that sort of thing, and how after conception and also potentially at birth and like labor and delivery, those things can happen. So he wanted to monitor me closely and make sure I got the best care. He is from India. And so he exposed me to what care looks like for women in India during pregnancy, dramatically different than what's happening in America and probably the UK and other countries. Because
Right.
I'm finding out the UK is just as bad as the United States, sadly.
Yeah.
But he talked about like rest and support and who's helping you and blah blah blah. And then when you have the baby, who's taking care of your baby for the first X number of months? And I was like, what do you mean? Me. And he's like, oh,
Right.
well, in India, our parents come and get our kids and
Mm-hmm.
take care of them because my job was to take care of my wife in healing. And he's like, obviously, we got to see our babies every day and those sorts of things, but it was our parents' responsibility to make sure that we were educated and we were ready to take care of our kids. And he's like, in hindsight, it made a lot of sense because there was so much to learn. And how could my wife do all of that
Right.
just going through all this
Having
shit,
a baby.
her body, her mind, her hormones, and all these things? So he's like, so I hope you have support. That level of care and hearing that from another healthcare provider let me know I was not crazy or doing too much or like some new age something when I was a doula and a midwife while unemployed. Like I was just like, somehow I'm gonna get a job and I'm gonna figure this out. Like,
right.
So after firing my first OB and started working with Crystal and I started working with you, I took childbirth education classes. I learned a lot. So much so that I took it back to back. I took it twice. I took a lot of notes. We developed a birth plan together. You talked to me about like how to prepare my body, stretching, how to sleep, ways in which to eat. If I started to go into labor, that I needed to rest. There were so many times where I'm like, people talked about nesting, and I'm like, I don't know what that's like. So I asked, and then I organized and reorganized. and reorganize.
And
Both was
reorganize,
causing
yes.
a room, and you were like, "Girl, sit
Lay down.
down, go to bed. Oh yeah, and drink some water. Like
Take a nap, drink some
take a
water, use
nap,
the restroom, and get
cut
back
it
in that
out,
bed.
cut it out. Like you don't have
Yes.
anything to do. Stop it." So, um, so I felt mentally prepared. I was really calm. I had this, this a sort of ideal birth plan. And
Hmm.
there was one night where I what I realized after birthing children twice is that either it was the place I used to work that stressed me out the day before something happened
Hmm.
with my kids, or that was like there was something happening in my body when my children were getting ready to come that like threw my emotions all over the place.
Hmm.
So the night before this journey, which we're going to talk about more in part two, I was upset that day. I had a headache. I had been crying at work. Something stressful did happen at work,
Right.
but I was also like exhausted, and I had this headache that I could not get rid of. And I don't normally jump to like taking medication and things when I have a headache. I try to get hydrated. I try to move my body. I tend to stretch and say like, okay, you've been at a computer, maybe there's some tension, like just chill. And I went to bed really early to the point where my mom was like, something's off because you went to bed at like 5.
Yeah.
Like she normally got home around 6 from work because she had moved down to support me. And she was like, you went to bed really early. And so when I woke her up in the middle of the night, you and Crystal, my midwife, both happened to be up in the middle of the night. And I remember texting you first and saying, I got this headache and like I'm really tired, but like I can't get rid of this headache. Like,
Yeah, I remember.
what's going on? And you immediately said, you need to call Crystal.
Right.
Call Crystal. And she's like, well, here, go to this hospital. They do really well with like people who have midwives and things. They're just going to check, probably give you some medicine, and then you'll come back home.
Hmm.
It
Hmm.
doesn't sound like you're actually ready to deliver. And I wasn't. But I went and I just happened to take my hospital bag. Why? I don't know. It was there. I was like excited. My best friend Ashanti had gotten me this cute little like bag, and I was ready to go. So I'm like, let me just take it. Me and my mom literally are thinking we're going to the hospital and I'm coming back home in like 3 hours
And
max.
you were like, what, 37, 36, 37 weeks?
I was
Or was it
38 and a half weeks.
38? Okay.
Yep. And I was like 5 days from my due date or something like that. No, I was a week from my due date. Sorry. So like literally exactly a week. So it was 38 weeks.
Okay.
And get to the hospital and they do these tests and I find out I have preeclampsia.
Yeah.
So in part two, we are going to talk about preeclampsia and that whole traumatic week of trying to deliver this child that could still be in my body. So, Arija,
Yes.
thank you for joining me for this episode. Thank you for sharing your passion and your love for the work that you do with us. And we will see you in episode 2.
Absolutely.
Thank you for tuning in to the Uncaped Mama podcast. Follow me on social media on Instagram, Uncaped Mama and care_Bath and Body. I hope that you found this episode inspiring, relatable, and impactful. And I hope that this triggers a thought in you to be a better support system to a mama near you. Help her to put down the superwoman persona, to put her cape down, to be whole, to be all that she is destined to be as a mother and more. See you next time.